Hello everyone. Today we're going to be discussing epidemiology. Epidemiology is defined as the study of the cause, distribution, and control of disease within populations. In our country, one of the uniformed branches of service is called the U.S. Public Health Service, and they are in charge of our public health as a nation. The Centers for Disease Control and Prevention is under the control of the Public Health Service, or the PHS. A lot of what we'll be discussing today involves learning the language of epidemiology. So we'll be looking at and thinking about a lot of terminology, including what you can see on this slide, which describes the kinds of disease outbreaks that can occur in a population. When we use the term sporadic, we're saying that this is an outbreak of disease that is occurring locally, it's occurring occasionally, and important, unpredictably. That's what we would describe as a sporadic outbreak. The term endemic means something very different. Diseases that are endemic are continually present at predictable levels in a population. For example, the common cold or influenza is endemic in most parts of the world. These are diseases that we expect to flare up or have outbreaks from time to time, but we can predict how big those outbreaks will be and when those outbreaks will occur. Epidemic is a term that describes an outbreak that's occurring at a level that's greater than predicted for a particular population. And finally, a pandemic is simply a global epidemic. So typically, a pandemic involves a pathogen that is brand new, or what we would call a novel pathogen. A pathogen perhaps that has existed for a while and has gone through a mutation to change it sufficiently so that it is now considered novel, brand new. It has traits that it has never had before. Back in 2009, we had a pandemic of H1N1 influenza. And of course, right now, we're experiencing a pandemic of the virus that causes COVID-19. I have the name of that virus at the bottom of the slide here. The formal name for this novel coronavirus is SARS-CoV-2, and that stands for Severe Acute Respiratory Syndrome, caused by a coronavirus, and it's the coronavirus that is listed as number 2. Some other terminology that we need to know specifically relating to epidemics is how the epidemic arose. And we use the two terms common source and propagated source to describe these. A common source epidemic is an epidemic that arises when large numbers of people become infected from a single contaminating source. A good example of this type of epidemic would be if a commonly accessed food source or a commonly accessed water source became contaminated with a pathogen. All of the people who then consumed that food or consumed that water could then become infected from that one common source. Sometimes the common source for an epidemic is actually a person. People can be carriers of certain infectious diseases. A carrier is simply someone who carries the pathogen in their body but doesn't get sick from it themselves. A famous historical example of this is Typhoid Mary. Mary was a cook in homes in New York City during the mid 1800s. And unbeknownst to her, she was a carrier of a particular type of rickettsia that causes a disease called typhus. Typhus causes people to have terrible nausea and vomiting and diarrhea, and it can lead to dehydration and death. So in Mary's day, epidemics would break out of typhus inside households, and Mary would pick up and leave one house and go to work in another house, and another epidemic would break out. It took the detective work of a health inspector in New York City to realize that Mary was the single common source for these epidemics. A different type of epidemic is the propagated source epidemic. In this type of epidemic, people are transmitting the infectious disease one to another. So instead of there being a common source that everyone gets exposed to, as people get infected, they then go out and infect other people. Influenza epidemics are propagated source epidemics, and of course, the pandemic that we're experiencing right now is another type of propagated source epidemic. Two terms that we've been hearing a lot lately are these terms, quarantine and isolation. These terms mean very different things. When we quarantine, we are taking someone who has been exposed to a contagious disease, and we are taking them out of the population. We're separating them from everyone else, we're restricting their movement, and we're going to wait to see if they come down with the infectious disease. Isolation occurs after a person becomes sick with an infectious disease. Once a person becomes ill, we want to separate them from the population again and allow them to recover without passing along the infection to other people. The United States actually has several quarantine and isolation laws on its books, and these laws are sometimes surprising to people who didn't realize that our government, both our federal and our state governments, have a fair amount of power under these quarantine and isolation laws. These are what are referred to as police power functions. And in the Constitution, they are related to the right of any state within our United States to take action against any individual for the benefit of society. So, in other words, the state has the right to restrict the activity of and restrict the freedoms of people and animals and plants and all kinds of other materials that are capable of spreading disease in a population. The police power functions stretch to the borders of the United States, so it gives Border Patrol agents the right to take action against the spread of infectious disease. It allows anybody coming into the United States to be subject to certain medical examination to make sure that they're not bringing the disease into the country. We saw some of this early on in the COVID-19 pandemic. We're still seeing it today at airports when passengers who are coming off of airplanes from other countries are subject to having their temperature taken, for example. That falls under these police powers. The quarantine and isolation laws do allow for government authorities to take action against someone against their will. A lot of what we've seen implemented in our country in recent weeks has been voluntary, but it is legal for states and the federal government to take actions against people's will. In other words, it's possible for a state to tell someone to stay home, and if they don't stay home, the state can then take them into custody and force them to stay out of the popular society. The other thing that our quarantine and isolation laws allow for is for the seizure of domestic animals and also the roundup and seizure of wild animals, so that they can be subject to culling. Now, if you're not familiar with the term cull, it's just a fancy way of saying kill. It's possible for the government to seize domestic livestock, for example, and kill those animals in an effort to prevent an infectious disease that they have from spreading to other domestic animal locations. All of this police power comes out of the Constitution, specifically in what's known as the Commerce Clause. And it's the Centers for Disease Control who is in charge of carrying this out for the states and the federal government. On this next slide, you can see a map of the United States, and several of these pointers in yellow and several yellow dots on the map. These are what are called quarantine stations, and they've been in place for a long time, since the beginning of our country, essentially. These are federally run facilities where people can be quarantined, and again, sometimes against their will. You might be surprised to see that we have a quarantine station in Massachusetts, in the Boston area. There's a quarantine station in New York, in Pennsylvania, in New Jersey, and at other locations around the country. Again, the Centers for Disease Control is in charge of these quarantine stations, and if you were quarantined at one of these stations, they would be responsible for taking care of you, for making sure that you were fed and making sure that you were monitored while you were there. Because remember, when you are quarantined, you are exposed to the disease, but you're not sick with it necessarily. And that brings us to the idea of the reportable disease. If you are working as a health professional in the United States, you are required by law to notify your local health officials, your state health officials, and in certain cases, federal health officials, if you see any cases of what are called reportable diseases. And the reason we do this is because we want to make sure that we know when epidemics are beginning, when we start to see a number of cases that is unusual, more than what we would expect. So, for example, if a physician were to diagnose someone with HIV/AIDS, as a veterinarian, if I were to find an animal that I suspected had anthrax, people who are diagnosed with multiple drug-resistant tuberculosis. All of these are reportable diseases. The professional who makes the diagnosis is responsible for reporting it. And again, it travels up the chain. It gets reported locally, and then to state officials, and then finally to the federal government, depending on the disease. There are several different diseases in our domestic animals that have to be reported. I have a list of them here. Things like newer pathogens like the Zika virus, certain types of influenza have to be reported. And again, these reportings that people make help us keep track of these diseases and keep a database so that we know if there's unusual activity of a disease in any particular area, and that allows us to act. Among the reportable diseases, there are also what are called quarantine listed diseases. If a disease is on the quarantine list, it means it's a disease that could result in a person being either quarantined or isolated if they're showing symptoms. So things like cholera, diphtheria, active or infectious tuberculosis, plague, smallpox, I've got a partial list here. And you can see down at number 9, the SARS and the MERS diseases are on the list. If you're not familiar with these, the SARS stands for Severe Acute Respiratory Syndrome. MERS is Middle Eastern Respiratory Syndrome, and both of those are coronavirus diseases. So, of course, our new SARS-CoV-2 is also now on the quarantine list. So, let's look at some terminology that epidemiologists use every day in their role as disease detectives. One term is index case. The index case is the first person who gets identified in a population as having an infectious disease. So you could think of the index case as being the first case that then is going to spread and create the epidemic. During the HIV epidemic back in the 1980s, epidemiologists worked very hard to try to identify the index case. Interestingly, after a lot of hard work and research, it was discovered that there really wasn't a true index case for HIV, and that in fact HIV had been present in the world for decades prior to the 1980s. The reason that HIV became epidemic in the 1980s was because a single person happened to be a male flight attendant. This man, who was particularly promiscuous, and he was also homosexual, and he worked as a flight attendant, so he traveled quite extensively. He unfortunately caught this illness, HIV, and then managed to spread it widely to multiple sexual partners, which is why we had the HIV epidemic first in gay men. So he actually would not be considered a true index case because he was certainly not the first person to have HIV, but he was certainly the common source for the early days of the HIV epidemic. In order to figure out who the index case is during an epidemic, epidemiologists have to work hard to trace every known case of the disease backwards in terms of who that person may have come in contact with. You can imagine that's a very tricky, a tricky thing to do, and it takes a lot of time, a lot of effort, and a lot of people to track backwards to the index case. A term that is frequently confused with index case is this term contact tracing. In both cases, epidemiologists have to start with the infected person and then do some detective work. But remember, when epidemiologists search for the index case, they look at everybody who's infected and they try to trace back to the first person who started the epidemic. Contact tracing is different. In contact tracing, epidemiologists interview the infected person and then try to come up with a list of all the people that that person has come in contact with in recent days during any of the time that that infected person may have been spreading the disease. Contact tracing is critical if you want to find people before they get sick, before they then go out and spread it to more people. Because if you can find them, if you can contact trace to all of those people before they get sick, you can put them in quarantine and you can wait to see if they come down with symptoms of the disease. If they do, you can isolate them and keep them from spreading the disease further. Another very important term in epidemiology is this term herd immunity. Herd immunity is a measure of the immunity to a pathogen in a population. It's based on acquired immunity, which is the immunity that comes from either exposure to the pathogen or vaccination against the pathogen. And it is based on the idea that if enough members of the herd or the population have acquired immunity to the pathogen, then the pathogen is less likely to break out in any epidemic proportions. In other words, when enough people in a population are immune, it's simply not possible for an epidemic to occur because there aren't enough people in the population who are susceptible. So when herd immunity against a disease is achieved in a population, we see the occurrence of that disease decline, and we also see that the people who are not able to acquire immunity against the pathogen get protected. This is a big part of the reason that we vaccinate widely in a population or a community, because there are individuals who are not able to get vaccinated and get protection against the pathogen. Typically, these are young infants, people who are elderly, and people who have other diseases that prevent them from being vaccinated. In order to protect those most susceptible members of society, we make sure that everyone who can be vaccinated gets vaccinated. Now, for many of our most serious and deadly infectious diseases, herd immunity comes through vaccination eventually. And of course, with our current pandemic, we're hoping to be able to vaccinate across the world against this coronavirus so that we can, again, achieve herd immunity on a global scale and greatly reduce the number of cases of COVID-19. For highly contagious diseases like this coronavirus and others, including diseases like the measles, that is very, very contagious, you have to achieve coverage in a population of about 90 to 95% in order to achieve this herd immunity. If there are 100 people in the population, you would like 95 of them to be immune. And that means either, again, through actual infection and recovery so that they have antibodies, or through vaccination programs.